Hello everyone, my name is Anita Goldenberg, and today I wanted to talk to you about Elsie, a 32-year-old female patient who was recently admitted and has undergone some treatment at our facility already. So today I wanted to start off talking about the patient's medical history leading up to today and discuss the plan I'm proposing for her nutritional needs as well as her education going forward. So to start, a bit of a patient introduction for Elsie. She's a 32-year-old female, as I previously mentioned, and her chief complaint on the current admission is headache, cough, diarrhea, fever, night sweats, rash, and general malaise, and all of this following a 3-month history of abdominal distension, poor appetite, a weight loss of 16 pounds, nausea, and worsening epigastric pain. The patient's height is 175 centimeters. Her weight is 53.6 kilograms, BMI is 17.4, UBW of 61 kilograms. The primary diagnosis is severe protein-calorie malnutrition, and the secondary diagnosis is a adenovirus pulmonary syndrome, valley fever, small bowel obstruction, secondary to escherichia. So diving into the escherichia. Hello everyone, my name is Anita Goldenberg, and today I wanted to talk to you about Elsie, a 32-year-old female patient who was recently admitted and has already undergone treatment at our facility. So today I'll start off talking about the patient's history leading up to today, as well as discuss the plan I'm proposing for her nutritional needs and the education that we will provide for her going forward. So a bit of a patient introduction to start off with. The patient is a 32-year-old female, as I mentioned, and the chief complaint on current admission included headache, cough, diarrhea, fever, night sweats, rash, general malaise, and all of this following a 3-month history of abdominal distension, poor appetite, a weight loss of 16 pounds, nausea, and worsening epigastric pain. The patient's height is 175 centimeters. Her weight is 53.6 kilograms, BMI of 17.4, UBW of 61 kilograms, and in terms of the diagnoses, the primary diagnosis is severe protein-calorie malnutrition, and the secondary diagnosis is a hantavirus pulmonary syndrome, valley fever, small bowel obstruction, secondary to escherichia. Now diving into the escherichia pathophysiology. So to provide you a bit of a background on this illness to begin with, it's an infection of the small intestine caused by a species of roundworm, and the common symptoms include cough, shortness of breath, fever, nausea and vomiting, abdominal pain, weight loss, irregular stool such as diarrhea, and loss of appetite. In terms of what our patient has seen with her symptoms, she's seen cough, diarrhea, fever, poor appetite, with the weight loss of 16 pounds that I mentioned, nausea, and epigastric pain. And in terms of the pathophysiology, the etiology of escherichia, this is usually exposure to or the ingestion of, the exposure to poor sanitary conditions or subtropical or tropical climates, or the ingestion of dirt or human feces. So then progressing to the patient assessment and summary. In terms of her relevant nutritional history that we should keep in mind, the patient does follow a vegan diet. She does have a history of vitamin D deficiency, and she also has type 1 diabetes. So then looking at the lab values that we've seen after her admission, in terms of the abnormal lab values, her hemoglobin is abnormal, as in it's too low at 10.9. Normal range is 12 to 16. The hemocrite, the patient's level is 34.3%. Again, this is abnormally low when compared to the normal range of 37 to 47%. Her red blood cell count is also low at 3.47. Normal range for her would be 4.2 to 5.4. And her vitamin D is also low. We see that hers is 12. Normal range is 30 to 60. And all of these are going to be very clinically significant when we talk about this patient in terms of both when it's in the context of her primary and secondary diagnosis, as well as the surgeries that I will speak about that she's undergone at our facility and how we can help her manage this going forward. So in terms of her PS statement, She has inadequate energy and protein absorption and a vitamin D deficiency as related to small bowel obstruction secondary to ascariasis, associated bowel ischemia, jejunum necrosis as evident by a reported weight loss of 16 pounds, hemoglobin levels of 10.9, hematocrit levels of 34.3, apologies for my pronunciation, red blood cell count of 3.46, and vitamin D of 12, as I just mentioned previously. All of these have led to a few surgical implications after the findings of these diagnoses. She's had a few exploratory procedures as well that were followed by small bowel excision, where her entire duodenum and the proximal portion of her jejunum were extracted. And all of these are going to be quite important moving forward. So just to dive into the areas that were involved. So the small intestine areas that were involved were the jejunum as well as the duodenum that I will discuss in a bit. So for the jejunum, this is responsible for macronutrient absorption, such as fatty acids, sugars, and amino acids, all derived from fats, carbohydrates, and proteins, respectively. Necrosis of the jejunum, obviously this is linked to the shortage of blood supply that has been going to the area. So this is likely contributing to the primary diagnosis of severe protein-calorie malabsorption, which results in the reported weight loss, the abnormally low levels of hemoglobin, hematocrit, red blood cell count, and it's also associated with low levels of protein, which we can see from these lab results. Also, the necrosis is resulting in intestinal failure, which has been shown to contribute to abnormal values for vitamin D, as there's a malabsorption of this as well when intestinal failure is present. Now moving on to the duodenum. So this portion of the small intestine is also involved with this patient, and in all humans is responsible for absorption of certain micronutrients, including vitamin D3 and iron, both of which we see a deficiency in for this patient. So the mass that was found during the exploratory surgery and the preparation that was found in the duodenum is contributing to the secondary diagnosis of small bowel obstruction secondary to ascariasis. These, of course, decrease the duodenum's ability to absorb adequate amounts of vitamin D, which is evident by the patient's abnormally low vitamin D levels, and the iron absorption is also impacted, and this can be observed by the abnormal red blood cell count, which is abnormally low in our patient. Moving on to the nutritional intervention that I would recommend based off of what we've seen. So just to summarize it, based off of the patient's current primary diagnosis, along with her type 1 diabetes, the low carbohydrate and high fiber protein glycerol formula is what I would recommend for her feeding. This is due to the fact that it would address her needs in terms of type 1 diabetes, not being able to consume as much carbohydrates, while also balancing it with the need for higher protein intake due to her deficiencies. So just to dive into these recommendations, for energy, I would recommend 1,557 calories per day, protein 107 grams per day, feed water 1310 milliliters per day, and in terms of water flushes, 100 milliliters every 4 hours is recommended. So looking ahead for the patient, the way that I found these recommendations was using the Mifflin formula from the Frankenfield and Ashcraft article. I recommend that our patient LC consumes the 1557 calories per day, and this also utilizing the Aspen Eternal formulas. All of these are in the reference section. I would recommend that our patient receives the glycerol formula as it is low in carbohydrates and high in protein. Since the patient has type 1 diabetes, limiting the carbohydrate consumption is key here. On the other hand, due to the earlier mentioned deficiencies linked with malnutrition in the protein department, the high protein aspect of the formula also fits on this front. Furthermore, utilizing clinical internal nutrition calculator, along with the protein per kilogram body weight recommendation from the article, a protein quantity of 107 grams per day is recommended, since the range typically is 1.2 grams per kilogram to 2 grams per kilogram. For this patient in particular, I would suggest going with the higher end of the range, so the 2 grams per kilogram, and this is to address the primary diagnosis of the protein energy malnutrition. The feed water and water flushes recommendation were also derived using the mentioned resources. And just to dive a bit more further into the calculations behind the calorie and protein recommendations, in terms of energy calories, again using the Milfin formula, I used this to obtain the patient's RMR, which I calculated to be 1308.75, and then proceeded to multiply that by 1.19, and that's how I obtained the caloric intake of 1557 per day. Then moving on to the protein recommendation, so taking the patient's weight of 53.6 kilograms into account, multiplying this again by 2, as I mentioned, the higher end of that recommended range, we received the value of 107 grams of protein per day. Now moving on to the patient education portion, this is very important, again, just to ensure that after the patient has gone home and now understands how she can better manage her health given the procedures that she has had. So following her bowel recession, it's recommended to consume small meals more frequently, so rather than the typical 3 meals a day, 6 to 8 meals per day until the bowel is fully healed. Also limiting fluid intake to 4 ounces with every meal as a maximum. This is to make sure that the nutrients that the patient is taking in are not getting flushed out by any fluid, and they're actually getting absorbed as they should be, given the smaller space of the intestine. Also, we want to make sure that she's including foods high in protein. This is, again, to bring her protein levels up, but also to help with the healing process. Avoid sugary foods. Include foods with soluble fiber, such as oatmeal, legumes, barley, all of that good stuff. And then adding vitamin D-rich foods as supplements or as foods high in vitamin D naturally. Again, this is to tackle the deficiency that we've seen and also help with the healing process. Moving on to a quick summary of our case. So again, when we met our patient, she was diagnosed with primarily severe protein calorie malnutrition and secondary the adenovirus pulmonary syndrome, valley fever, and small bowel obstruction secondary to ascariasis. The implications was a nutrient malabsorption leading to weight loss, abnormally low values for hemoglobin, hematocrit, red blood cell count, and vitamin D. And again, after all of this, both taking into consideration her type 1 diabetes, taking into consideration the reduced bowel size, and the need to bring these levels to normal ranges, recommend that she implements the nutritional recommendations to address the present protein, calorie, and vitamin D deficiency, as well as increase her well-being. And in terms of my references, here they are. I will include a link to this presentation as well, so you guys can have these references as well. And I just wanted to say thank you for your time, and yeah, thank you.